got a health question, don't guess yourself. Tune in now for Senior Health. Doctors you trust, clear and true. Expert advice just for you.
Yes, and it's Senior Health with your host, Rhett Palmer. And my very first guest on this all brand new show is Samson Griffith. Hello, sir.
Hello there.
Great to have you here.
Thank you for having me. I
He's
appreciate it.
he's a fellow New Yorker from way
Yes.
upstate near Buffalo.
Yes, Albion, New York.
Albion, New York.
Most people confuse that with Albany, but it's
Yeah.
actually Albion. New York.
Albion.
Yes.
And so it's up near, that's where they shoot all those Bear aspirin commercials in the winter, right? It's
Oh, really?
so
Yeah.
cool. So, but you really are not a New Yorker. You moved down here as a child at the age of 7.
Yeah, 1969. That's about, 10 years ago. Well, maybe a few more years than that, but
How old
Yeah.
were you in 69?
7 years.
Oh,
old,
well, I
yeah.
was 15 and I went to Woodstock in 69.
Oh, really?
Yeah,
Okay.
yeah. Well, anyway, it's great to have you here,
Sure,
and we're going to
nice,
be
yeah.
discussing some things. I've got some notes here that we set aside,
Okay.
and here we get to my notes here. And welcome, folks. And by the way, I know if you have any questions or anyone you want me to interview for the show, it is Rhett at verosvoice.com. We'll probably be setting up some other better email in the future, but here we are. We're starting out. Now, the Bible says, despise not small beginnings, right?
Yes, that's correct. Yeah.
So you and I getting healthy together, folks, staying healthy, and there's a whole lot of problems that are specific for seniors. I'd like to ask you this, Samson, and that is, how long have you been in the insurance business?
I've been in the insurance business about 24 years, specifically working with Medicare for about 16 years.
Medicare, okay.
Yes.
And of course, I had to face this decision a few years ago on these different plans that are available. What company do you represent?
I am an independent contractor, benefit consultant, and so I represent here on the Treasure Coast and nearby counties 10 different carriers. So as an independent agent and consultant, I'm able to actually contract and enroll with all of those companies.
So that actually benefits me, the consumer, working with you, just like I would go to a mortgage lender, and if he or she are independent, they can have all these different mortgage companies. You get turned down by one, you may get picked up by another. Is it sort of the same thing?
Sort of the same thing. Yeah, because everybody's different, has different situations. In some cases, I have a wife on one plan and a husband on another plan.
Really?
Yeah, and that fits their need. It may be based on maybe the doctor that they need to see, the specialist. It could be based on medication or just simply cost. So, it's not a one-size-fit-all situation. I kind of tailor it and do a needs assessment, find out what their needs are, and then from there, recommend a plan that would be useful to them.
Wonderful. Hold on, I've lost my questions again. Okay, so how does a person qualify for Medicare? What age do you need to be?
Well, you need to be 65 years of age and have worked at least 40 quarters, which is the equivalent of 10 years, and paid into the Medicare system, Social Security. And so when you see on your check stubs that little statement that says Medicare tax, then you are actually paying into that system. And after 10 years of doing that, then you qualify for Medicare, or you could be married to someone who has paid into that system for 10 years or more.
Oh,
and that
so they
will
make
qualify.
it pretty easy. It's sort of like Social Security, but not as expensive.
Yeah, correctly. Yeah, so that's the way, it's set up. And then someone who receives disability after being approved, they can get Medicare after 24 months.
Okay.
And then they become Medicare eligible. And then from there they receive their red, white, and blue card. And then from there, they are a person that I can actually deal with and assist.
There are a lot of seniors like myself, Samson, who they take money out of my Social Security check. Now, a lot of us rely substantially on our Social Security check. Why am I having to pay from that?
Yeah, so your Part A, which is your hospitalization, that's what's paid for through those 10 years of work.
The government.
Yes. So Part B is actually what you're paying the Part B premium for. And
What's that for?
That's for medical. So Part B is medical, and that allows you to be able to see doctors and specialists and get tests.
So A is catastrophic.
A is hospitalization.
Yeah.
So if you go into
Severe
the
enough.
hospital, it goes in under your Part A. All right, and there are a few other things that Part A covers, but Part B is medical. And the Part B is the one that you have to pay the premium for monthly, and pretty much everyone pays that unless for some reason you have maybe assistance from the state of Florida because of low income, or you could have a union or an employer that's actually paying it for you. So, but everybody pays that Part B
Now,
premium.
we hope that now with the doors are wide open for a show like this, we're going to be being heard nationally. So will this be applicable in other states as well, or do they have their own different laws?
Yeah, so the Medicare system is federal government,
Yes.
and so that will cover all states. All right, now when you get to, we'll talk a little bit about Medicaid, that's
Yes.
different, that's state oriented.
Oh, it
All right,
is.
yeah, so you have two separate entities that could work to help you with your medical when you get 65 and older or get your Medicare card. Federal Medicare, state Medicaid.
Mm-hmm. And Medicaid is for those who are either severely disabled or financially disabled.
Yeah, it's mostly financial when you get to the stage of Medicare. They go by basically your income and assets. And that's what it is dependent upon. And so the income and assets of an individual, the income and assets of a couple, that's what Medicaid is based on.
Because I remember there was somebody in our family, and the wife had died, and he goes into a nursing home and had to give up everything he had, including a Social Security check, and then Medicare paid for his room. I think it was Medicare paid
Medicaid,
for his.
probably.
Oh, really?
Yeah.
For in a nursing home.
Yeah.
I think it was upwards of $90,000 a year.
Yeah, so the Medicaid, there are different levels, again, based on your level of income. There's, I think, either 6 or 7 levels, right? But then there's other forms. Just to give you an example, a young lady who's, let's say, 20 years old and has a child at home,
Yes.
maybe she's pregnant, she can get a Medicaid to assist her with her situation.
If she okay.
But the kind of Medicaid that assists with Medicare is called the Medicare Savings Program, but it's still administered by Medicaid, right? And so that's the one that will work along with, you know, the Medicare in order to assist seniors who have Medicare.
So you are 7 years younger than me, I think, because I was in '69. I was 15, and '69 you were 7.
I'm 63, correct?
Right? Okay, and I'm 72, and so I was at Woodstock. I think I told you that. Yeah,
Okay.
So I'm officially a senior. So you're not a senior yet.
Not yet.
No.
Not by those standards.
You got the
anyway.
gray beard though.
Yeah, right.
You're getting
exactly.
prepared.
Yeah.
But you're in pretty dang good shape, man.
Yeah,
For 63.
Well, thank
Do
you.
you work
I
out at a
appreciate
club
that.
or something or not?
Actually, I don't. You know, most of what I have is, you know, by genes,
Well,
basically.
good for you.
Yeah. So.
Okay. Well, I need a blood transfusion, man.
Yeah.
So, how does a person qualify for Medicare?
All right. So once they get 65,
Yeah.
then they will get their Part A. Now, if someone continues to, let's say, work for an employer and they're under employees insurance,
Mm-hmm.
if that is the case, then they don't have to get the Part B. All right, because they have coverage that is as good as Medicare. All right. Now, when they get ready to retire, then they can apply for the Part B. So, in other words, if you have an employer's insurance and you're already paying for that there, you don't want to also be paying for your Part B.
Right.
Now, if you are collecting your Social Security already,
Mm-hmm.
then they will automatically send you the Part A and Part B. If you don't want the Part B at that time, then you can basically sign the back of a card to decline the Part B so that you're not paying the Part B premium, but the Part A is there.
Okay. Once a person qualifies, what options are available to them?
Well, I put it in 3 different categories. The first one is original Medicare. That's the red, white, and blue card.
Mm-hmm.
Okay, so that red, white, and blue card has on it, once you qualify, that's the Part A.
I have mine out in the car. I should have brought it in.
Yeah, I got mine. I'm going to turn it off here. But the Part A, which is hospital, and it also has Part B, which is medical. All right. So the Part A, again, I mentioned if you've worked enough, you have paid for that. And the Part B, you will have to pay for that. All right. Once that becomes active, both Part A and Part B, then you're also required to get a Part D, as in David, and that's for prescription drugs.
I don't know if I have that or not. I'm not sure. I must, because when I go to the pharmacy, they say it would have been this price, but it's this price.
Okay.
But or they'll say it's the beginning of the year. You haven't paid off your
deductible
yet.
Yeah.
And then when that's paid off, then I get all the discounts,
Right.
which can be considerable, by the way.
Well, it can be, yeah. But yeah, so that's what it is. The Part D is you're required to get it. Now, some people might say that, well, I don't take medications, I don't need it, and that's good for now. But if you ever get to the point where you do need it and you haven't gotten the Medicare Part D, which is the prescription drugs, then you will be penalized for every month that you didn't have it beyond 63 days. And with the cost of prescription drug plans, the way they are now, very inexpensive, so you can satisfy what Medicare requires of you and not have to worry about a penalty later in life, because that penalty will carry with you for the rest of your life. Right?
You're kidding.
Yeah, so it's good to just go ahead and get it.
Why would they do that? It seems severe.
Well, it's kind of the share of the cost, with everyone else. It's the kind of way they pay for it. You got to realize, like in most of your prescription drug plans, one way or the other, whether they're attached to a medical plan or not, you can get prescription drugs at no cost, all right, because they're generics.
Yes.
But we know pharmaceutical companies are not just giving away drugs free.
They sure
right?
are not.
And so the money that it takes to get those drugs, Medicare is actually paying a lot of costs for that. All right, and that's why you're able to get those at no cost. All right. So again, to get the plan itself is very inexpensive these days, and to have it even if you don't use it, it's better than getting later in life and then having to pay a penalty.
No, you don't want to do that.
Because you should do it.
What are the number one questions that seniors like me ask you?
What
befuddles them?
Probably just like you mentioned, the A, B, C, D. There are options about what direction to go, because you hear about Medicare supplements, you hear about Medicare Advantage, you hear about Part C plans. You have a Medicare Advantage?
Yeah.
Okay.
With Health
First, is it?
Yeah, I think so.
Okay, yeah. So that's pretty popular in Vero Beach. Actually, they're not in St. Lucie County, but they are from Vero Beach going north. Yeah, so with a Medicare Advantage plan, that's kind of your second option, probably the most, I would say, popular of our Medicare Advantage plans.
Why do they call it a bridge?
I've never heard the term bridge before.
Really? That's what I was told, like a bridge.
Like a bridge, yeah.
Do you have the bridge? I pay the bridge or something, and that way
Yeah.
I don't have to. So I know what it is. When I go in to see somebody and they'll say, oh, you have the bridge, so you don't have to pay any cash today.
Okay, now.
The insurance is going to pay for it or something?
Well, yeah, I've never heard the term bridge before.
Okay.
But if you have, like I say, the first option, right, A, B, in your Medicare red, white, and blue card,
Yep.
you got to get a prescription drug card also. So if you go to a hospital, red, white, and blue. You go to a doctor, red, white, and blue. Get prescription, then your Part D, which is the prescription drug plan. Right?
Yeah.
The second option is using your red, white, and blue card along with a secondary. All right, so Medicare red, white, and blue is primary, and then your supplement.
What is the secondary?
Is secondary. So that's what kind of picks up the cost that Medicare doesn't pay.
That must be what I have.
Okay, so the Medicare red, white, and blue is basically an 80-20 plan, right? They pay 80, you pay 20. So if you want to call it a bridge or a supplement, then that picks up most of that 20%. All right. For that, you will have a monthly premium that you'll pay for that supplement, but it kind of makes everything complete. You still have to have a standalone prescription drug plan. All right, so you got three parts with a supplement: your primary, and then your secondary, and then your prescription drug plan. All three separate parts. All right, which is a good option because if you receive your Part B prior to the year 2020, then it'll pick up just about all of your costs, right? But that's a Plan F. But a Plan F,
I think I have that.
The Plan F?
Yeah.
Okay, so if it's a Plan F, then that will cover the majority of things that Medicare doesn't cover.
But I'm paying monthly for that.
If you pay monthly for it, more than likely it is a supplement. Then.
Yep, that's what I got.
Yeah.
Now, what did I want to see here? Oh, I hear commercials talking about getting money back to your Social Security, and I don't quite understand how that whole thing works. I know I had a congressman in here recently, and he explained that about getting money back. I would prefer they just send me the check.
Okay.
But anyway, pay money back to Social Security. And what about this receiving a prepaid card to help with utilities and groceries? Many people wonder, is that a scam?
Yeah, so here's what that is, right? The third option for the Medicare, we mentioned the original Medicare supplement. The third one is called a Medicare Advantage plan. All right.
Yes.
So Medicare Advantage plans, they're called that because they give you some advantages that original Medicare don't give you.
Oh, okay.
All right. And what they do is they take and put your A, B, and your prescription drugs all in one plan.
Okay.
All right. In most cases in this area, there's no additional premiums besides the Part B premium that you're already paying.
Yeah.
All right. That's why it's, a lot of people like those.
Yeah.
And some of those plans, depending on the plan you go with, the company you go with, your situation will actually give you money back to your Part B. All right. So this year, the Part B premium that everybody's paying, again, unless, somebody else is paying it for you, is $202.90. Right? Some plans will give you up to $185 of that back to your Part B. So now you only have what's left. All right. So the Medicare Advantage plans are, you do have co-pays and co-insurances. You limit it to a network. In cases of an HMO, a lot of people say, I don't like HMOs. But HMOs, you limit it to a network of doctors. If you go outside of that network, they will not pay. A PPO gives you an in-network and an out-of-network.
Oh.
The in-network, if you stay there, you're going to pay less. The out-of-network, technically, you can see any doctor you want to see that accepts Medicare. But you may have to deal with the billing yourself, right? So you may have to take and submit the bill to the company and be reimbursed, right? So all of these are Medicare Advantage plans, but they're kind of designed for people, who have low maintenance, that, they're not going to use it that much. To see a primary doctor is next to nothing or nothing. You see specialists are, low cost, $30, $40, whatever the case may be. And so that's why a lot of people go there, because you not only can you get on those that, you're not paying anything additional like you will with a supplement, but also they'll give you some money back to your Part B. All right. As far as the utilities and the food card, those are basically designed for people who have both Medicare and Medicaid.
Oh, so it's a little deceptive, the advertising.
Well, if you read the fine print, you'll see that it's not, because it'll tell you that it's not available in all areas.
Yeah.
And then not everyone will qualify. Yeah. All right. But that's not the part that people hear. All they hear is that, it's I'm going to get money back from my Part B, and I'm going to be able to use this for healthy foods, and that's what people seem to hear. Yeah.
When is the annual enrollment period for Medicare?
The annual enrollment period is from October 15th to December 7th.
Why do they limit it to such a short little window?
Well, it allows them to be able. It used to be October, 15th, all the way through the end of the year. But what happens is that they cut it off at the 7th. That way everyone can get their new medical cards and all their enrollment information prior to the beginning of the year. And then the effective date will start January 1st. So that's your annual enrollment period. And typically that's when you can make changes,
But you have to, if you don't get in, then you have to wait a whole nother almost a year to get it.
Yeah, you're kind of locked in, but they do have other opportunities in order to make a change
Because
between.
one of your birthdays in January.
Well,
Then you got to wait all year until the fall again.
Well, the thing is that when you turn 65, then it doesn't matter what time of year you have a special enrollment to be able to enroll.
Oh, you do.
That's the initial enrollment period.
Okay.
Yeah.
Well, that's nice to hear. I didn't realize that. Now, let me ask you this. Samson Griffith is my guest, by the way, ladies and gentlemen, and you're tuned into Senior Healthcare Questions. I'm Rhett Palmer, your host. His name is Samson Griffith. He's an independent benefit consultant specialized in Medicare plans and life insurance. If people want to ask you more questions, can I give out your number here?
Sure.
Which number would you prefer? Is it the mobile?
Yeah, the mobile. Yeah.
Okay. 772-971-6878. That's 772-971-6878. And you can also reach Samson. You can mail to what is it called?
Yeah, InProNational.
Okay.
Yeah.
InProNational at Comcast.net. Okay, InProNational. What does that mean?
InProNational is a corporation that I developed, some years ago.
Oh, it's your own corporation.
It's my own corporation.
InProNational. InProNational. InProNational is in and then a pro and national at Comcast.net. Is there anything that I've been remiss in asking you today?
No, I think that's it for the basics of Medicare. Of course, there's a lot more detailed things that people may have questioned, like how do you qualify for Medicaid, right?
Sure.
So Medicaid, like I mentioned, it's income-based.
Do you help people with that too?
I do help people with that if I can assist them to get on that. And there's a reason why I use the in my title, consultant, because, I have people simply call me and ask me questions that I can't do anything for them.
Yeah.
So in other words, I'm not making any money off of them, but,
it's a service.
It's a service. I'm happy to help people because, like yourself, you're turning 65, you're getting all this mail that's coming in, a ton of it. You're getting these calls, you're watching the soap operas and then the commercials pop up. You drink the Kool-Aid, you make a call, and they're, so it's a lot of information that's coming at you all at one time. And people just don't know what to do with it. You got Part A, you got Part B, you got Part D. They put them together, it becomes Part C. Then you got a supplement plan G and a supplement plan F. And, it's very confusing. So that's why I'm happy to do what I do. Because I assist people. When I leave a person, even if I can't help them, I feel good about myself because I know I have given them enough information to make an informed choice. And then from there, my business basically is operated from word of mouth. I don't do any advertising. I did when I first started, but now I don't. So mine is all by word of mouth, clients who talk about me.
That's the best way.
That's the best kind of advertising.
I know in my former broadcast that a lot of what they did, that doctors did pay me, but they found it, but I would only take on those that I believed in and trusted. Now they have a word called influencer. Back then, there was no word influencer, but I was an influencer because I had many doctors say, Rhett, you helped me build the practice. But as I said, being a conduit between my listenership, I will not take on somebody or promote somebody who I don't, think qualifies or I do not believe in. So I think that's important. So anyway, if you want to listen to this broadcast again, of course, you can go to our podcast. And the title will be, of course, Samson Griffith, Medicare Plans and Life Insurance. Thanks for coming in today.
You're welcome. Thanks for having me.
You drove all the way up from, it took you about, 45 minutes to get here?
Probably about 35.
That's not bad.
Yeah, not bad.
Thank you very much, sir. Nice to have met you. God bless you and be with you.
Thank you.
And folks, we're here for you, to serve you, getting healthy together. I am your host, Rhett Palmer. Thank you.
Thank you.